Hi, we're going to talk today about perimenopause. It's those years that are called the run up years to menopause, and it seems that a very large number of women in India today are going through these years. In fact, there's a Times of India study as recent as 21st July this year, which puts this number as 15 million women in India. It's an issue which impacts a lot of us, including me, and it is also discussed a lot, but I feel still understood very little. So, technically, menopause is defined as when a woman does not get her period for an entire year. There is what is called the perimenopause years. And the reason we need to talk about it is because most of us are sadly not breezing through these years. We are struggling with a few symptoms which are now identified as common and affect a large number of women, and having to deal with those symptoms. We are today going to talk about two such symptoms, mainly because I think I have experienced some of it, and I have dealt with clients who have come in with those symptoms, and also I feel they are a little difficult to deal with when they happen. So let's take these up one by one. One of these symptoms is what is called systemic inflammation. Now, while inflammation is a word that we use a lot these days, it is still difficult to recognize inflammation in one's own body. So, how would you know whether you are inflamed or not? And when I'm saying systemic inflammation, then we are talking about an inflammation of not just one area or one organ, but rather the whole body feels inflamed. Most commonly, the terminology we use around this is called bloating. A lot of women will say, I feel bloated, especially after they have eaten a meal. But mind you, the association is that I must have eaten something or I've had a heavier meal and hence I'm feeling bloated. But this is not the case if you have systemic inflammation. You're going to be bloated in your gut irrespective of what you eat. The second way you're going to notice this is like a swelling. So some women will say that my arms and my legs feel swollen. They feel swollen when I look at them. They feel bigger when I look at them. And then at certain times, they also seem to come back to their normal size and shape. So feeling swollen is another sign of inflammation. The third way you can experience inflammation is in your skin. So the skin can feel tight. Some people will complain and say, my skin feels like it's really tight, and that can be a sign that you're inflaming somewhere from inside. Especially in the perimenopause years, you are going to experience some inflammation in your lower abdomen, or the area what is below the navel. So if you press it, and especially if it is during your periods, it can feel tight, it can feel bloated, and it can often come with some amount of pain. So what can we do about this inflammation? The first thing to do is to get your vitamin D levels checked. Look, I'm a naturopath, and I'm all for not taking supplements unless absolutely necessary. But vitamin D specifically has a lot of correlation with inflammation. So the first thing you want to do is get your levels of vitamin D checked. And yes, there are food that can help build it up gradually, but if your levels are fairly low, so think of it as a level which is below 10 or single digit level, then please take the standard supplementation that is now fairly commonly available, and get your vitamin D in order. If you are experiencing fatigue, lot of sleep disturbances and pain in your muscle and joints and bones, then that is some additional indicators that your vitamin D might be off. So the first thing you want to do is sort the vitamin D part for yourself. The second thing I would tell you to do, and this is where, how I as a naturopath use food as medicine, and what a lot of other naturopaths would also do, is to give you some food suggestions that specifically help in inflammation triggered by the menopause symptoms or the perimenopause symptoms, right? By the way, it's also worth understanding, and the Times of India article that I mentioned earlier, we'll put a link of it in this video so that you can read it further, that there is almost something like the dying ovary. So in your last year before you hit menopause, your ovaries are actually dying, right? They're kind of living off their last few days, and at that time they release certain chemicals which your body's immune system responds to. They are not recognized as the normal things that the body has, and hence it is seen as an attack from the outside. And that is also a reason why, especially during your period cycle, you can feel inflammation a lot more. So if this is happening to you, one food item that is immensely useful is what we call a sponge gourd. I don't know why, but it is basically the common tori. This is the season for tori in North India, so the markets are full of it. The only thing you have to choose is tori is of two variety. One is a fairly large, tight-skinned tori, which also has seeds. Not that one. The other one are the smaller ones. They are thinner, they are darker green in color, and they usually are not straight but coiled. So tori as a vegetable is what you can absolutely use to take care of this inflammation. Now, how do you use it? Best way to have it is to have it as a vegetable juice. Take two toris, wash it properly, wipe it with a cloth, cut it and use a normal mixie, half a glass of water, and just churn it. Churn it enough so that it almost reaches a puree-like state, and then add one more glass of water to it, sieve it, and have it. This is about 250 ml or 300 ml of juice. Best time to have it is empty stomach in the morning, but you can also have it when stomach is empty, which is usually after 2 to 3 hours after a meal, any time of the day. Definitely have it once a day. Anybody can have it. There is no restriction on who should and who should not. The second way you can consume tori, the vegetable, sabzi, or vegetable out of it. The only thing you want to be careful here is that if you add a lot of spices and a lot of oil, then you're going to ruin the nutrition in it. So the simple way of cooking it is just use little bit of onion, little bit of cumin. This can be made absolutely oil free, but if you insist, then one little spoon of oil, saute the onion and the cumin, chop up the snake gourd or the tori, and at least have 3 to 400 grams of it as vegetable. You can add a little bit of coriander powder and a pinch of salt and a pinch of turmeric or haldi to it. Let it cook for 15-20 minutes in its own water. Please don't make it in a pressure cooker. And this sabzi or this vegetable in a cooked form is also something you must consume. And you can have it every day for as many days as you want. It will really help you. The third and last way this can be consumed is in the form of a chutney. So when you are making the vegetable as a sabzi, you're going to peel off the skin. Please don't throw the skin. Gather a palm full of this peeled rind or skin of the tori. Add a little bit of fresh coconut to it. Add a little bit of fresh ginger. A little bit of, you can add a date. You can add a little bit of imli and some salt and make it into a chutney. Now, again, just remember, when you're using food as medicine, then quantities really matter. So if you're going to have 1 teaspoon of this chutney, it will do nothing to a body which is over 50 kgs of weight. So what you need to do is, you at least need to have a small katuri food of this chutney. You can have it with plain white rice, little bit, or you can have it with an idli. So this is basically best in combination with a rice-based thing, but the quantity matters. So these 3 ways of using tori, and if you are struggling a lot with inflammation, then you can use it every day, all these 3 things together. Another symptom in perimenopause, which is, I feel, not talked about enough, is excessive bleeding. I think in the medical lingo, they call it abnormal uterine bleeding. So this is where you are anyway seeing a difference in your periods during your perimenopause or almost what is called the menopause years. Your periods are either showing signs of change in terms of the periodicity of them. So they no longer come in the same regularity that they used to, or they are coming very frequently and then not coming for a few months, which is also not uncommon as a thing that women experience. It becomes very problematic when the bleeding around the periods becomes excessive. So for some women, the bleeding is excessive. The duration of the period remains the same, but the amount they bleed tends to increase. For certain other women, they just continuously bleed for 3 to 4 months or 5 months. The periods as if never stop. You've just had one round of period, and before you know it, there is continuous spotting or there is some continuous flow of blood, and then another full period comes. This is, of course, the most problematic, because a very logical outcome of this is going to be anemia. And then if you get into severe anemia, you've got a whole bunch of other issues to deal with. Now let's try and understand why this also happens. And there are two big factors as to is a buildup of heat inside the body. How are you going to recognize this heat? If heat is a lot in your upper area, like your stomach, you can always notice it as blisters in your mouth, especially under the tongue or on the tongue. So blisters in the mouth are not always a sign of the vitamin B deficiencies, but also these are called heat blisters. You sometimes, you get pimples as an adult, but these are not the normal acne. What you are getting are more painful pimples, which if you press, they are painful and they have a little more redness to it, as opposed to the normal whitehead pimples that teenagers experience. The third sign that your body might be overly heated is dryness. So there can be dryness in your scalp, there can be dryness in your hair, there can be like dryness in your skin, and you can just get up in the morning with a dry mouth. So this is also a sign that there is a lot of heat inside your body. What are you supposed to do if you have this? And also, just one more thing, the base of inflammation is always heat. See, inflammation is a process of expansion, it's a process of swelling, and for something to swell or expand, you always need something to be hot under it. So excessive heat is also a reason why inflammation happens in the body, right? So what can you do about it from a food perspective? Juices that you can have if you are experiencing this dryness and excessive heat are plain carrot juice, about half a kg of carrot or 500 grams of carrot, which will give it 300 milligrams of juice. That is something that you can consume safely on a daily basis. The other juice is cucumber and tomato. So 2 cucumbers, 2 tomatoes. You can add a little bit of fresh coriander or a little bit of fresh mint to it. This juice does not lend itself well to a mixie or a grinder. So it is best if you juice this in a juicer and have it. It will be about 200 ml of juice. You can again safely have it empty stomach in the morning or again in the late afternoon, as long as you're keeping a gap between the juice and cooked food. The third thing that really helps if there is a buildup of excessive heat in the body and it is causing you that excessive bleeding are pears. So this is the season in India, because we're in the monsoon season, when pears, we call it nashpati or babugosha in Hindi, is very freely available. Babugosha is better than the nashpati to consume, and you must eat it. You just need to wash it. You don't need to take out the rind or the skin, and eat it as much as you want. It cools the heat in the uterus as well, and it overall cools the heat of the body. Especially if you are experiencing heat in your kidneys or urinary system, which is most noticeable if you have hot urine or burning urine, then you must eat the babugosha or nashpati in large quantity.